I'm Dr. Ajay Kumar, and in this presentation I'm going to talk about determinants and outcomes in research. Now this is one of the first of a series of presentations we are going to have where we are going to discuss principles of epidemiology or research. Let's kick off. What is research? And one of the simplest definitions I've heard about this is from my teacher. He used to say research is nothing but investigation into truth. It's a systematic method of searching what is the truth. Any research for that matter, the ultimate objective is to discover cause-effect relationships or associations between several variables. Doesn't matter what kind of research, whether it's observational studies, descriptive, analytic, experimental designs, whatever be the research, we are always interested in looking at associations. And the reason is that if we know what causes the effect, then it gives a great survival edge in nature. The knowledge of truth gives survival edge. And if you look at it, all human beings are innate researchers. We are always interested in what causes whatever is happening around us. And the basic premise of all health research is that disease or any health related event for that matter is not randomly distributed, is not happening by chance. If it's really happening by chance, then there's no way to predict it. But fortunately, they are not happening by chance. There are patterns or associations. And the objective of research is to actually pick up these. Why does somebody get disease while others do not? Maybe they are genetically predisposed. Maybe they have a particular behavior which makes them predisposed or puts them at a higher risk of getting disease. Maybe they are exposed to certain biologic agents. They are exposed to certain bugs, maybe certain bacteria, certain viruses, which is involved in the disease process. Or maybe they are living in environmental conditions which are not conducive for health. Or they may be in situations, there could be political turmoil or social factors or economic factors or a combination of several of these, which ultimately makes a person more at risk of getting disease as compared to those who are not exposed to these things. So the idea of health research is to capture some of these. Let me take you through a research framework. And if you see here, there are two states shown here, a state of perfect health or well-being and a state of disease or dysfunction. In fact, we can't dichotomize this situation like this. It's actually a spectrum and a journey from a state of health to a state of disease and back. And there are several factors which are determinants which determine whether you move from health to disease or vice versa. And those could be divided or classified as host factors or etiologic agent factors. It could be environmental factors or certain time period. So this is classically known as the epidemiological triad, the host, environment and the agent factors, a combination of these three acting together to cause either health or disease. So simplistically viewed, there are just two variables that we are interested in. One is the outcome, other one which determines the occurrence of this outcome or the determinant. And there's a lot of jargon around this, and we should be very clear. The most common terms that are used is exposure and outcome. Exposure meaning the cause and outcome meaning the effect. And here exposure, you will have to view this as a very broad term. Normally we use the word exposure in terms of getting exposed to some radiation or some chemical. Here, any variable to which you are having is called as an exposure, which is considered to be a cause under study. And the other term that we use is independent versus dependent. just to mean exposure and outcome. In statistics, in the field of statistics, these terms are more common. They use dependent variable for outcome, and because they say this is dependent on some other variable which is called as independent variable. So cause versus effect. So we are going to use these terms very often, exposure and outcome, in all our discussions, and I would like you to be very clear about what do these mean. And often we are in epidemiology obsessed with a simple 2x2 table. And if we are able to put together our variables in the form of a 2x2 table, we seem to be in control. And so this is how we normally and conventionally arrange ourselves. The outcome variable right on top as a column heading and an exposure on the side as a row heading. And then if we can fill this up as a result of our research, then we can say if exposure is in fact associated with outcome. So let's take some examples. So for example, in randomized control trials, we are often looking at is drug A associated with cure. In this case, drug is the exposure and cure is the outcome. Or we can also see is drug A associated with increased risk of adverse effects as compared to drug B. And this is again here, drug is the exposure and the outcome here is adverse effects of the drugs. The drugs can also be used to prevent diseases. For example, you can use some drugs for chemoprophylaxis and which can be used to prevent malaria when you're visiting a particular country. And so the outcome could be prevention of disease. So there are other examples. For example, vaccination. Is the risk of disease lesser among those who are vaccinated as compared to those who are not vaccinated? In this particular example, getting vaccinated, that is the exposure, and prevention of disease is the outcome that we are interested in. Similarly, we can look at a TB control program. Does it reduce death due to tuberculosis? So you can look at countries which have a TB control program. You can look at countries which do not have a TB control program and look at TB deaths as an outcome to measure. So here, having a TB control program in the country becomes the exposure. Similarly, the other example is having an emergency obstetric care in a hospital vis-a-vis not, and what is the impact of this on maternal mortality. So any research that we are doing or you're planning to do, we need to be able to delineate very clearly and explicitly what is our key exposure variable and what is the key outcome variable that we are interested in. Let me take you through several examples in several study designs, and one of the key things and the undercurrent of all these examples is I would like you to always look at what is the exposure in this study and what is the outcome. Let's look at a possible case report. One of the commonest form of publications in research is a case report. It's just a report of medical oddity. Let us say there was one case report of rabies which was successfully treated with a particular new drug. Just one report, one case. Now, what is the exposure and what is the outcome in this particular case? If you look at this, the drug A is the exposure and successfully treated is the outcome. Although we do not have a control arm, but we know from history that rabies could never have been, we know that there is no cure for rabies. So if you have a first case of rabies which has been cured with anything, that is going to be a revelation, and so we have a sort of implicit control here. Let's take another example. So this was a case series which was reported from Mumbai, India, that there were 12 cases of totally drug-resistant tuberculosis in Mumbai, and of which about 10 cases were previously treated with multiple regimens in the private sector. Now, what is the exposure and what is the outcome here? In this case, the exposure is getting multiple treatment regimens in private sector. That is the exposure. and the possible outcome that we are looking at is totally drug-resistant tuberculosis. So although I see again the other arm, the control is not there. We know from control that we know from our general knowledge that it's not often as we see here, that we see multiple regimen treatments in private sector. So we get to see what is the possible exposure and what is the possible outcome in these particular studies. It becomes very, very clear in other designs. For example, if you look at this particular study, an old one, this is an ecologic study, and we are going to learn about all these study designs much later. But suffice it to say that this shows a relationship between the rate of dental caries in children and the fluoride content of the public water supply. And if you look at this particular graph, each dot represents a community where we have plotted two things. One is the fluoride content of the public water supply in that community, as well as the rate of dental caries. And if you look at this, we clearly see that the rate of dental caries was higher in communities where the fluoride content of public water supply was lower. And so what's the exposure and what is the outcome here? The exposure in this particular case that we are interested in is the fluoride content of public water supply, and the outcome is dental caries. So I think it becomes very, very clear now. Let's take a few other historical examples. So this is about cholera, at a time when we did not know about what caused cholera. Today we know very well that it's caused due to the enterotoxic Vibrio cholerae. But it was not the case at one point in time in 19th century. So at that time, when there were a number of deaths due to cholera, there was several hypotheses moving around as to what caused cholera. And William Farr was the Registrar General of London at that time, and he had a hypothesis that cholera was due to what they called at that time as the miasmatic theory of disease, which meant that the disease was due to a miasm or a cloud that clung low on the surface of Earth. And so they hypothesized that is the reason, you can see that the cholera deaths are higher if you are living at a low altitude as compared to that if you are living at a high altitude. And in fact, William Farr put together some data. If you can look at this particular table, it becomes very, very clear that you can see a very clear trend and a relationship between residents, elevation above sea level, as well as the number of deaths due to cholera. And you can clearly see that people who stayed at lower altitude had a higher risk of dying from cholera. Of course, John Snow did not agree to this particular hypothesis. John Snow always believed that it was the contaminated water which caused cholera. And so he put together some data supporting his hypothesis. If you look at this particular table here, it shows what is the company which supplied water to people. And there were two big companies at that time. One was the Southwark and Vauxhall company, and the other one was Lambeth company. And if you look at this, you look at the deaths from cholera here, you find that the death rate per 10,000 houses was 315 in Southwark and Vauxhall company, as compared to Lambeth company, where it was only 38 deaths per 10,000 houses. So it was very clear from this that it's actually the water which made all the difference. And in fact, there was some information that Lambeth company, for some non-technical reason, had shifted their water source to an upstream part of the Thames River, which is much less polluted as compared to Southwark and Vauxhall, which was drawing its water from the downstream part of Thames. So this was very convincing. In fact, it convinced William Farr to change his hypothesis and order that every cholera death has to be investigated with reference to what is the water source. So again, you can see in the first instance, it was looking at elevation above sea level as the exposure and cholera death as the outcome. Whereas in the second case, it was the source of water supply which was the exposure, and death due to cholera as the outcome. Let's look at another example, another classic example. So this is a portrait of Edward Jenner doing the first ever vaccination for smallpox. Again, another situation where, what is the exposure and what is the outcome. So the exposure in this particular case was smallpox vaccination, and the outcome is prevention of smallpox. Another classic example from Austria. So this is Semmelweis, the guru of hand hygiene. And if you look at this particular data, he observed that the maternal mortality due to puerperal fever or childbed fever as it was called then was higher in the first clinic as compared to the second clinic. The first clinic was where the physicians and the medical students were involved in conducting deliveries, whereas in the second clinic it was the midwives. So it was a sort of concerning finding. Why did women die more often in the first clinic when they were being handled by physicians and medical students vis-a-vis the second clinic? So if you look at here, the exposure is whether you are delivered in a first clinic or the second clinic, or whether you are delivered by physicians and medical students or midwives. And the outcome that we are looking at is maternal mortality due to childbed fever. If I like to continue this particular story, he figured out that it was because that the physicians and medical students were conducting autopsies in the morning, and they came straight from the autopsies to the first clinic to conduct deliveries without washing their hands. This was the case. So he hypothesized that they were carrying germs from the cadavers and infecting the women in the delivery rooms. So he said that let's do a hand hygiene intervention, which means that the physicians, after having done their autopsies, have to clean up their hands, take a brush, take a soap, clean it up, and then after cleaning they would conduct and come and conduct deliveries in the first clinic. And if you look at this particular graph, it actually made all the difference. And if you look at this, around 1847 the hand hygiene intervention was implemented, and then which brought the maternal mortality down to where the level which is about 2% in the second clinic. So in this particular case, the exposure was exposed to hand hygiene intervention, and outcome is prevention of maternal mortality. We can go on for several examples. This is food outbreak investigation, where they are looking at several foods implicated into whether a person got sick or not. And if you can see here, it's a cross-table analysis for egg salad and beverage consumed in a particular jail in Miami. And you can see here that we are looking at two exposures here. One is eating egg salad or not. The second exposure is drinking a particular beverage or not, and then seeing the outcome is whether you get sick or not. So you can have multiple exposures and multiple outcomes in the same study. This is another example of same thing. So this is looking at age-adjusted lung cancer death rates per 100,000 person years by urban-rural classification and by smoking category. So there are two exposures we are studying here. One is smoking, which is in two categories, never smoked or regularly smoked, and then urban-rural classification depending on the population, whether you are a rural, suburb or town, small city or a big city. And you can see that both living in an urban or rural area as well as smoking was associated with lung cancer death rates. And in this particular example, this is another example looking at what are the risk factors for cancer esophagus. And you can see here we are looking at two exposures. One is smoking, the one is drinking alcohol. And the outcome that we are looking at is cancer esophagus. Now, this is one of the things as you begin to ponder about your own research question. Make it very clear in the research question itself what is the key exposure that you are interested and what is the key outcome that you are interested. This makes it very, very clear. In fact, there's a nice quote that I want to say. A question well asked is a question half answered. And we are going to go through this process in great detail. The way we frame our research question or hypothesis, it will clearly tell us what are the variables that we are interested in, what data we need to collect, how we need to collect, where from, everything. So the entire study methodology is going to flow if we are very, very clear with our research question. And one of the components that we need to clarify in the research question is what is your key exposure, what is your key outcome. Thank you.